Back in 2023, state lawmakers unanimously approved and the governor signed off on the creation of a task force to study the persistent problem of missing women and girls who are Black, Indigenous, and people of color, including addressing the discrepancy in how these cases are handled compared to when white women go missing. For more on the implementation of this task force, we're joined by the measure's Senate sponsor, Southern Tier Democrat Lea Webb. Thanks for making the time, Senator.
Thank you for having me.
Well, before we get into the status of the task force, can you explain why it was important to sponsor legislation creating this task force in the first place?
Yeah. Well, first, again, thank you for having me. And again, no family or anyone should ever have these experiences. And at the same time, there's so much research that underscores that there's so many women and girls that go missing every year, but at very alarming and disparaging rates are BIPOC women and girls. More than 250,000 BIPOC women and girls go missing every year. And so New York is seeing very similar trends. And so when I helped to push this legislation forward, along with my dear friend and colleague in the Assembly Member Carinas Reyes, it was designed to not only reduce the challenges in this space, but to really remedy justice and healing for those community members that are being impacted. And so the task force was created as a way to try to really address this very, very challenging public health and safety issue. What we found in doing the research is that quite often BIPOC women and girls are often classified as runaways, when in fact, in large part, they have been kidnapped or put into human trafficking and or in some cases murdered. And the task force, which is made up of state agencies that have oversight in this space, so the Department of Criminal Justice Services, the Office for the Prevention of Domestic Violence. There's several other state agencies as well. It's around a 9-member task force. And we also have community stakeholders who literally are doing the work on the ground, entities like Girl Vow and others that are literally on the ground helping families to find their loved ones that have gone missing.
Well, let's talk then a little bit more about the task force itself. It's my understanding that they have met multiple times, although I'm not sure if the meetings have been public and there were some concerns about maybe the timeliness of a draft report earlier this year. What's your sense of how the work is going?
So when the law was passed in 2023 and went into effect in 2024, the task force took some time to come together. And so they started meeting last year in 2025. There had been some community convenings as part of the legislation. And most certainly, I'm looking forward to actually seeing the report. I know from preliminary conversations with some of the state agencies that are involved with the task force, along with some of the task force members, one of the partners that was brought on to facilitate the report is right out of Albany, at Albany, the Youth Justice Institute. And so they were a part of doing community conversations, looking at data, and working with the task force members. And so I'm looking forward to seeing the actual draft report and final report, because I know there's going to be a number of provisions that are policy changes that we need to look at. A big one I can anticipate is in the area of training and most certainly education and awareness. A lot of times people don't know what to look for if someone is a victim of human trafficking. I've done legislation along with my colleague, Assemblymember Reyes, and others to even have signage in public transportation hubs, your truck stops. We just did a day about a week ago now with the Truckers Association, letting people know what to look for as it pertains to human trafficking. So these are some of the things I anticipate will be in the report, which is supposed to come out sometime between June and July, with not only recommendations, but also the conversation needs to continue in terms of outreach for raising awareness, but also looking at training for respective public safety officials, but also the community at large.
Well, you mentioned in what was one of the impetus for this task force, this issue of law enforcement classifying some of these missing women as runaways. And I wonder how much of that stems from maybe inherent racism, either in these institutions or among the individuals themselves who maybe have outdated or certain stigmas that they believe in. How do you combat something like that? I mean, is it just about training? Is it about representation in the law enforcement ranks so that it's not, disproportionately white and that it is more representative of the populations that need help? I mean, how do you think about something like that?
I think it's important that education and awareness is happening for everyone, whether it's with law enforcement, the community at large. I've seen just even in my area in the last 4.5, almost 5 weeks, there have been a number of children and young adults that have gone missing. Knowing who to call or what resources even exist, that's important for everyone, not just simply the respective law enforcement entities when people are going missing. Social media is a tool that a lot of community members are using to raise awareness, but we also need to have our partners in media involved as well. And in the research that has been done in other states and communities around this disparity, media is a part of that outreach that needs to happen with regards to lifting up these stories. And so I think it's a combination of training, more community awareness, and most certainly making sure that those that are impacted, that they're actually getting connected to services to help them in their healing journey. A friend of mine who lives right here in my district, when she was sharing her story about how she was human trafficked at the age of 14, I met her later on in life, and her even sharing her story about how she was approached and essentially coerced and put into a human trafficking ring, and how she was able to break free. Like, even understanding that it's not always the stranger, it's people you may know. In my work in doing this legislation with Assemblymember Reyes and a lot of our stakeholders that do work on the ground, there are community members that, because they may live in an area with limited law enforcement resources, have had to utilize bounty hunters to try to find their loved one. And what I am saying is that the system itself has to be addressed. I am hoping that not only with the recommendations that the task force is going to put forward, but we most certainly need policy supports, but most certainly budgetary investments. And we need everyone in the community to address this issue. I'm really hoping that we will, as a state, really render justice to our community members. We have significant Indigenous communities that have even more limited resources. And
Sure.
so some of the work that the task force is looking at is how do we establish more supports for our Indigenous community members who are being disappeared at even larger rates. And so these are the conversations we need to start having. And this is why, with the task force and how it was constructed, it's the combination of various law enforcement entities, state agencies, but also folks who are literally on the ground, not only helping to find community members who have gone missing, but also helping with their healing journey. That is just as important, along with rendering justice through our criminal justice system.
Well, unfortunately, that's all the time we have for this conversation. We've been speaking with State Senator Lea Webb. She's a Binghamton area Democrat. Senator, thank you so much for making the time. I really appreciate it.
Thank you, David. Thank you for lifting this up.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.